So, hi Anjali, I'll welcome you for this session. Heartiest congratulations on getting rank 53 in your
Thank
INICET May. And
thank you, sir.
you were also very good ranker in NEET with a rank of 180, although I know you don't want to talk about it, but yes, for
Uh,
most of the people out there, 180 is a very, very good rank. And you are already AIIMS alumni. You are your undergraduate from AIIMS and you have just finished your internship. So heartiest congratulations and welcome.
Thank you, sir.
So how are you feeling now? Is it something that has satisfied you or you're going for November?
No, sir. So I'll get the branch that I want this time. So this is it. The entrances end here. No more entrances for me, sir.
Very, very good. What is the branch you're looking for?
I am slightly confused between medicine and derma, but
Okay.
like because I'm the first gen doctor, so probably it'll end up in medicine.
Medicine. Okay, fine. Well, you are between two very good branches, so that is fine. This confusion is a good confusion.
Good confusion. And that comes with a good rank, no, sir. So when you have a good rank, then this new
Yeah.
confusion arises.
Yes, yes. And sometimes this confusion is far more than probably getting a rank somewhere mid, where most of the
Huh.
subjects are out. You are only between 3, 4 subjects. तो
Yes,
वो
sir.
easy होता है. ये वाला बहुत difficult होता है जब सब मिल रहा होता है तो.
True, sir. True.
Yeah. And especially for somebody who is a first generation doctor, तो घर से बस सपोर्ट ही मिलता है कि बेटा जो भी तुम लोगे हम तो उतना ही प्यार करेंगे.
True. True,
हाँ,
sir.
वो
मतलब वो तो हाँ मतलब there is no speciality that you need to specifically follow because ultimately आप अपना ही कुछ करने
अपना
वाले
ही
हो.
कुछ करने वाले हैं. Yes. बिल्कुल बिल्कुल बढ़िया. So tell us, take us through your journey from whenever you thought of starting your preparation to finally when you ended up with this rank.
So at AIIMS, the general trend is to begin the PG preparation in full swing from the beginning of your internship. And so before that, we are reading the core textbooks, and then in internship, we look towards the coaching material. So that kind of ensures that you have also gone through the main text and your concepts are in place. And the notes which are actually exam oriented, you are seeing it in the last lead, that is towards the internship when you have to appear in the exam. So that is when I started, full-fledged preparation. And so the process of notes making begins in your third year as soon as the DAMS begins with their classes and all. So we are a COVID batch. So
The lucky
so
batch.
so we kind of have shifted from the face-to-face classes to the online platform. And I guess DAMS has managed to provide a smooth transition between the two. So that has been really, really helpful again. So I have relied on DAMS completely for obs and gynae and physiology. So these two subjects, I think I haven't seen anything else. And as well as derma, I have not seen anything else. So these 3, 4 subjects, I've completely relied on DAMS for them. And I think they've done a pretty well job providing those crisp, concise notes which you can take forward and appear in both NEET as well as INICET. And Dipti ma'am and Sumesh sir, I think me putting it again would not change it. They are the mentor duo, and matlab unki guidance, motivation is required to sail through this process. At least once you will go see their videos, get motivated whenever you're down. So वो तो एक mandatory ritual है ही हम aspirants के उसमें.
And very surprisingly, I am also one of those people who have been actually physically motivated by both of them. I have actually sat with them in their old Karol Bagh office, and we have had, that was not the time of YouTube videos and Facebooks and stuff like that. But in 2012, when I was down and out, I actually sat with two of them and both of them motivated me, both for studies and finally for taking up my branch. So yes, I can understand that, connect with them. They somehow say the things that one wants to hear.
That just gets hammered in your head. Matlab, that pierces through the emotions. Maybe you were crying, maybe you were upset over some GT score, but then it pierces through it and you are able to get it. What the message they are trying to give you, you get that message. Sir, other than that, I have used your short courses, I would say, more than your the long videos. So I have gone through the TND. And I've also used AIMS capsule, but that has been a very selective read. What my seniors have guided me, like I have watched the ventilator from the AIMS capsule, the contraceptions in obs and gynae, So, and the graphs that ma'am in physiology covers, specifically, the Ganong graphs which come in INICET. So I have used them, and also the DVD course. So especially paths, sir needs a mention here. Sir has actually covered almost all the images, not too directly from Robbins. And he has also come up with his own flow charts for HIMAT, which are very useful, when those are the four options that are there in those four leaflets of the flow chart. So that actually helps you, you know which point to choose from the question stem, so that you can differentiate between the four options. So paths, specifically, this time also there was an image from that module. So it just helps you. DVT helps you to retain, grasp concepts faster. And, at the last moment, you can see that before the exam as well. So that is something that I've used thoroughly for this preparation.
So you have picked and choose things that you have kind of gotten as a legacy from your seniors, and something that you would have understood कि यहाँ ये कर सकते हैं, वहाँ वो कर सकते हैं. And
so the good thing about the teaching at DAMS is कि for example, if you're covering only 50 topics out of the many which are there in that subject, so those 50 subjects, that 50 topics are actually covered in full depth. So कि itna information is sufficient. So that is, I think, a plus point, especially for minors. Now, you have, around, I still remember watching Derma was like 1.5 days class live. So the whole of Derma gets completed. And then the Q bank is also very small. So you are done and dusted with Derma in like 3 or 4 days at max. So you need not give more days to that. So that is an advantage, that minors are actually minors here, and they're not so lengthy.
ऐसा नहीं है कि नाम short subject है लेकिन पढ़ जो है वो हफ्ता भर रहे हैं. Absolutely.
So minors may, I think that is an advantage.
And ultimately, you must be realizing it कि no matter how much you want to read, ultimately the retention capacity is limited to a certain extent. So whatever your primary source is, it has to be that crisp that you can start revising it again and again before the exam, rather than just keeping on just putting a lot of information from here, there, everywhere, and then at the end it doesn't really has any remembrance.
So you are able to differentiate. जो आपके concepts होंगे ना, आप अपनी subsequent reads में you will not go through them. That is a fact. So again and again your eyes will catch hold of the facts. So the more relevant facts you are, skimming through again and again, it is better, because ultimately that information, that factual information is volatile. तो अगर उसका bulk बहुत ज़्यादा होगा तो वो retain भी उतना ही कम होगा और उतना ही ज़्यादा confusion होगा. Especially INICET is notorious to give you very close options. So वो relevant information, जो relevant facts हैं, वो limited होने चाहिए so that they are on your tips.
Yeah. So crisp is what you would always go for.
हाँ, because concepts can be lengthy, but then you will not review them ever, because वो है आपके उसके अंदर memory के अंदर रहेंगे ही. Once formed, they are forever formed.
And how did you what exactly did you change between your NEET and your INI? There were 2.5 months. So is it something different that you did? कि हाँ चलो अब NEET is done and dusted, so let's move on to INI.
So for NEET, I had not completed the TMB course. Okay. So for all the second year subjects, I went ahead with the TMB, and I was solving AIIMS ascents for previous year questions. So whenever I was like, nahi yaar, ye answer isme sahi nahi hai, so I knew that I had to go back to DAMS, check the answer there, and take whatever answer and explanation they are given as true. If it is a controversial question, then that is the final one. So that is how, because INI has a habit of asking previous year questions. So that has been the motive key in those 2 months. Then I'm able to also see the, the AIIMS questions once again before I appear in the exam.
Okay. But then this time there were not many PYQs that got repeated. So how did you feel that in the exam? Did you keep a plan B कि अगर ऐसा नहीं आया तो what would then your strategy be?
Sir, actually, this has been discussed multiple times, that now, when we say that the examinee is getting smart, the examiner is getting smarter. So even the examiners at AIIMS know कि previous year topics एकदम रट कर सब आ रहे हैं. तो there has been a shift of trend. तो ये तो पता था कि concepts अगर आएंगे तो वो हो जाएगा. और जो वो लोग गूगली क्वेश्चन पूछेंगे वो किसी को नहीं आएगा। हाँ, तो फिर वो जो उन क्वेश्चंस के लिए वरी नहीं करना, एंड जो कॉन्सेप्ट बिल्ड क्वेश्चंस है उनमें गलती नहीं करना।
मतलब जो नॉर्मल हमारा एक असेसमेंट रहता ही है कि एम्स इज नोटोरियस टू गिव 20 क्वेश्चंस व्हिच आर बाउंसर्स,
कंप्लीट बाउंसर्स,
बट देन दैट डजंट डिसाइड योर सिलेक्शन और रैंक। दे आर,
दैट इज देयर मोटो आल्सो ना। मतलब अगर वो आपको मतलब 180 मिनट्स ही दे रहे हैं टू सॉल्व दैट पेपर, दे वांट कि आपका फर्स्ट इंस्टिंक्ट बाहर आए। तो वो चाहते ही नहीं है कि आप एक गूगली क्वेश्चन, मतलब वो गूगली क्वेश्चन इसलिए है सो दैट यू वेस्ट योर टाइम देयर। It is not to decide your rank, it is basically to make you waste your time, because 200 questions हैं और सिर्फ 180 minutes हमने आपको दिए हैं। तो वो तो फर्स्ट गो में देखते ही कि चारों ऑप्शंस में से कुछ नहीं पता, छोड़ो आगे चलो। You do not have to even mark that for review, बस आगे चलो उसके बाद।
Yeah, that is a very nice thing that you are telling, because we are inside information है ना, AIIMS mindset. This is something, yes, that has to be practiced, especially for INI, कि if the bonker question is there, then not even put it for review. Very, very important point. Because ultimately, if it is for review, you will find time for it, you will go back and you will again give some 30-40 seconds to it. And
then that is again waste of time, क्योंकि चारों options में से कुछ पता तो है ही नहीं। तो वो ultimately it is a arrow in the dark. तो है ही नहीं।
How many questions did you attempt?
Sir, I attempted 193. Yeah, so 7 of them I had no clue. I was not even able to point out कि subject कौन सा है, तो मैंने कहा छोड़ो।
And approximately how much you think you have checked? कितने सही होंगे उसमें?
Sir, I have not checked, but from what I have heard of discussion is the topper has somewhere around like 170, 168 correct. So I think
165 के आसपास होगा।
हाँ, तो इतना तो मैंने भी किया। So because ये मुझे पता था कि हो जाएगा, तो मैंने अपने आप को उस 1 week में वारी ही नहीं करा कि रिकॉर्ड देखना है।
So you had that confidence when you came out of the exam कि हाँ ये हो जाएगा, मतलब ये लग रहा है कि इसमें अच्छा किया है।
हाँ, मतलब ये था एक, तो बस रिकॉर्ड पे देखा नहीं सर।
नहीं, बहुत अच्छा है। That is very nice. I like students who have a very clear view about these entrance exams, because these days it's more about a trend that we are following. तो कुछ लोग बस they are in this exam zone for a very long time, but ultimately I feel the goal of all of this is just to take a seat and leave. Life starts after you take up the PG seat, and then you do a specialty and super specialty and become a practicing.
The journey ahead is still long ना। मतलब ऐसा नहीं है कि 3 साल बाद आप बस बाहर वर्कआउट कर रहे हो और आपका हो गया। तो वो तो है नहीं, अभी भी लंबा है।
Yes, yes. I often say this ना, 3 साल के बाद निकलते हो तो no red carpet for you, even if you are AIIMS topper or anything. Ultimately, you are a neonate in your specialty. आप तो वो आपसे 1 साल पहले या 6 महीने पहले भी पास हुआ वाला बंदा आपका सीनियर ही रहेगा हमेशा।
सीनियर ही रहेगा। True, sir.
So that is wonderful. Anything else that you want to share regarding your journey with your friends?
Sir, I guess I have more or less covered, but yeah, मतलब there are lot of ups and downs, lot of bumps. There are a number of days when you do not wish to study. There are a number of days when you just want to, give up, not look at books, maybe go out, chill, have dinner or something of that sort. Maybe dress up for a while. But ठीक है, मतलब you have to keep walking.
हाँ, ये सब आपको भी होता है ना? हाँ. तो ऐसा नहीं है कि अंडर ग्रेजुएशन फ्रॉम एम्स, इवेंचुअली पोस्ट ग्रेजुएशन फ्रॉम एम्स, 50 रैंक, तो ऐसा नहीं है कि यू आर इनविंसिबल, कि आपको तो कभी फर्क पड़ता ही नहीं है या डिप्रेशन आता ही नहीं है. इट इज वेरी नॉर्मल.
That is normal, sir.
And one has to accept it and maybe take a day or take an evening off, regroup, and then try again.
So, I once met Sumer sir. तो सुमेर सर ने यही कहा था कि अगर पेपर में तेरे को मुश्किल लग रहा है तो तेरे साथ और भी लोगों को मुश्किल लग रहा है. अगर तेरा दिन बुरा जा रहा है तो किसी और का भी बुरा दिन जा रहा है. तो इसका गिल्ट या बैगेज नहीं रखना. As soon as you are able to recover, start again. तो बस वैसे ही start again वाली चीज थी. So I think I've carried this advice for the last 6 months or 8 months now.
That is actually a very important part that we need to put out, क्योंकि बहुत सारों को ऐसा लगता है कि हमें में प्रॉब्लम है, हमको ही क्यों ऐसा बुरा लग रहा है, बट सबको लगता है. Everybody has. अच्छा, tell me that you guys now you told us कि तुमने बहुत pick and choose किया ना?
हाँ.
इसका ये उसका वो बड़ा specific है. तो how did you avoid the FOMO of so many sources and so much material दैट इज इजीली अवेलेबल. एक तो होता है कि अगर हमको हर चीज खरीदनी पड़े तो वो फिर उसमें क्या होता है, रूल आउट हो जाता है कि ये खरीद सकते हैं ये नहीं. बट आप भी जानते हो आजकल सबको सब चीज फ्री में भी मिल जाती है. तो आपने वो फोमो कैसे अवॉइड किया?
सर तो इसका क्रेडिट तो हमारे सीनियर्स को जाता है. तो हम एम्स में एक टर्म यूज करते हैं, फट्टे. फट्टे मिलते हैं हमें इस चीज के कि कैसे पढ़ना है कैसे नहीं पढ़ना है. तो उसके अंदर वो लोग दे प्रोवाइड यू विद दैट मटेरियल की ना कि दिस इज व्हाट यू हैव टू रीड. एंड ये वो है कि अगर आपके पास उस टाइम पीरियड में स्टिल कुछ टाइम बच गया है तो अब आप ये भी कर लो. बट अदरवाइज ये सो मोस्टली इन द एंड वी आर लाइक इंटर्नशिप में स्टार्ट करते हैं तो जो एक्चुअल वीडियोस होते हैं वो तो हमारे लिए एकदम आउट ऑफ स्कोप हो जाती हैं.
yes.
तो हम लोग मोस्टली रिविजन वीडियोस या फिर शॉर्ट कोर्सेज जो होते हैं उन पे फोकस करते हैं. एंड सर हैविंग सेड दैट हम उसको इसलिए ग्रास्प कर पाते हैं बिकॉज वी हैव रेड द कोर टेक्स्ट बुक्स बैक इन आवर प्रोफेशनल एग्जाम्स के टाइम्स. तो दैट इज हाउ वी आर एबल टू आई गेस मैनेज. तो इफ somebody is starting early तो I think that is kind of an advantage कि आप सारी वीडियोस देख पा रहे हो, इवन द लॉन्ग कोर्सेज आप देख पा रहे हो एंड नॉट जस्ट द शॉर्ट कोर्सेज. तो सर फोमो तो नहीं होता है इसके बाद क्योंकि टाइम ही नहीं रहता इतना.
अल्टीमेटली इट्स जस्ट कि अगर आप इफ यू आर स्टार्टिंग अर्ली देन यू हैव अ बेटर अंडरस्टैंडिंग ऑफ हाउ टू अप्रोच. बट वुड यू से दैट अगर कोई सिर्फ लास्ट मोमेंट पे सिर्फ जो कंसाइज एकदम सुपर कंसंट्रेटेड टाइप के जो रिवीजन पैटर्न्स होते हैं, प्रोग्राम्स होते हैं, वो अगर सिर्फ उनको करके सोच लेगा कि मेरा हो जाएगा, हाउ गुड दैट वुड बी?
सर having the experience of both the exams I would like to say कि नीट के लिए still doable है बट INI के लिए enough नहीं. INI में सर बिकॉज एक मीडियोकर रैंक का कोई पर्पस नहीं है.
मतलब इवन 500 का कोई पर्पस नहीं है.
हाँ सो क्योंकि उसमें वो सीट्स ही नहीं है उनके पास इतनी कि आपको दे सके. तो अगर आप या तो आप ऑल इन हो या फिर आप ऑल आउट हो इन INI. बट नीट में ऐसा नहीं होता है. एंड नीट में गिवन दिस टाइम्स एग्जाम सभी रिपीट था ऑलमोस्ट 2021 से लेकर उन्होंने 2 साल का मिक्स पैक दे दिया था. तो आई थिंक उसमें बहुत एडवांटेज है. तो नीट बिकॉज दे आर शिफ्टिंग टू क्लिनिकल सो दे हैव अ लिमिटेड क्यू बैंक टू फॉलो. तो नीट के लिए तो आई थिंक शॉर्ट कोर्सेज जरूर करके जाने चाहिए. INI PYQ का बाप, मतलब वो नीट वाला PYQ का बाप और DVT है. तो मतलब उसी से कितने टेस्टिमोनियल्स हैं कि उससे ही हो गया बस. तो दैट इज आई थिंक फॉर नीट इट इज वेरी एडवांटेजेस बट फॉर INI नहीं होगा, उसमें वो नहीं होगा.
बट देन अगेन बैकग्राउंड वर्क तो लगेगा. कोर कॉन्सेप्ट बिल्डिंग हैज टू बी देयर. Nice. So Anjali, that was just wonderful. You are very lucid and I feel very happy talking to students like you. जिनको पता नहीं somehow तुमको सब चीज पता है, सही पता है. अच्छी बात है. I wish I was like this when I was your age, but yes, I think you have earned this lucidity in your life कि हाँ मुझे exactly क्या है. तो I feel very very happy and proud that I get a chance to talk to someone like you. And
so the pleasure is all mine sir. ये इंटरव्यू करना तो मतलब कभी जब सैड डेज होते हैं ना तो एक्चुअली मिरर के सामने हम लोग प्रैक्टिस करते हैं. रैंक आएगी तो ये इंटरव्यू ऐसे बोलेंगे.
वो भी एक स्ट्रेटजी होती है मोटिवेट करने की अपने आप को कि अपना विनिंग स्पीच लिख के रखो.
तो सर तो ये इंटरव्यू करना तो इट इज ऑल आवर प्लेजर सर, बिलीव इट. मतलब बहुत अच्छा लगता है.
हां, यू हैव डिजर्व्ड इट. इसीलिए यू विल फील मच बेटर अबाउट इट. इसको सेव करके रखोगे इस वीडियो को फॉर अ वेरी लॉन्ग टाइम बिकॉज नाउ यू आर देयर ऑन YouTube forever. So it was really nice talking to you. I wish you all the very best and
thank you, sir.
Hope to see you as a great physician.
Thank you, sir.